Another variation of a common pattern in IBS is what we call restaurant syndrome. I call restaurant syndrome, where someone who has the diarrhea predominant, maybe IBS more so than the others, is sitting down, they're ready to begin their meal, they take 2 or 3 bites, and they're in the restroom. They have to leave the table and go to the bathroom to have a bowel movement. So their dinner's interrupted with their family, they disappear from the table. This doesn't happen only in restaurants, it happens frequently in the home. And again, it interrupts the family quality of life and the individual's quality of life. And it can be very embarrassing at the same time. This is, again, something that can be adequately controlled. Notice I'm not using the word cured or eliminated, but controlled, so people have better quality of life. Another variation of IBS that we sometimes see is and this is rarely see, I would say difficult to identify. It's called the splenic flexure syndrome. And it's a variation of irritable bowel syndrome, where the location of the patient's discomfort or pain is under the left rib cage, where the spleen is. That's why they call it the splenic flexure. The other reason they call it the splenic flexure, because that's where the curve of the colon there's the spleen over there on the left side. Of course, your liver's on the right side, and this turn here of the colon on the left side is called the splenic flexure, or the splenic turn. And one of the reasons why people sometimes the splenic flexure occurs is because the splenic flexure is the highest point in the upright position, is the highest point of the colon. And of course, inside the colon, there's a significant amount of gas. And one of the things that happens to people who have irritable bowel syndrome is they're very sensitive to over-distension of the wall of the colon. And when you distend the wall of the colon with the gas that can frequently accumulate in that area, that can cause pain and discomfort. So a combination of spasms and accumulation of gas in the splenic flexure can cause localized pain in the left upper quadrant. I'm sure most people who develop this, that becomes severe enough to send them to the doctor, end up with CAT scans, colonoscopies, and other things, and of course blood tests that have to be normal. In the case of splenic flexure syndrome, again, a variation of irritable bowel syndrome. Most people suffering with IBS have intermittent symptoms, made worse again by stress or foods, stress at work, stress at home. Certain foods, what kinds of foods? Fatty foods, greasy foods, fried foods, large meals, a buffet dinner rather than a small portion dinner, cruciferous vegetables, gas-producing foods such as broccoli, cauliflower, Brussels sprouts, bananas, carbonated beverages, just to name a few, are foods that can exacerbate the symptoms of IBS. Some people, however, instead of having intermittent symptoms, have more constant or persistent symptoms. And they're present most of the time, and again, made worse by stressful foods. I want to just briefly talk a little bit about nausea as an IBS symptom. Typically, we don't think of nausea as a symptom of irritable bowel syndrome, and you don't see it in the Rome criteria, but I would call it an atypical symptom of IBS. And if your medical doctor has evaluated your gallbladder, checked your liver, done an endoscopy to check your stomach, and you've had and possibly CAT scans and even colonoscopies, and all these tests are negative, and you have a picture that looks like typical IBS with some nausea, this can be seen in people with irritable bowel syndrome and does seem to respond to some of the usual IBS management. Vomiting, however, is not a symptom of IBS and needs further medical evaluation. Um, it's also important to talk about some patients that have urological or bladder symptoms that may overlap or be associated as well with an IBS picture. Typically, it's pain in the area of the urinary bladder, irregular urinary stream, in the absence of infection, and a negative evaluation by a urologist. These symptoms of bladder spasms, if you will, may also be associated in some patients with irritable bowel syndrome, and it can be very confusing. These bladder symptoms, again, may respond to IBS medication. We're going to talk about what those are in just a moment. Another group, women, may notice a pattern of IBS exacerbation or IBS-like pain worse during their menstrual cycle, suggesting a hormonal relationship. And frequently, patients will take their IBS medication at certain times of the month when they anticipate that their symptoms may be flaring during their cycle. Lower abdominal pain and pelvic pain frequently can be associated with pelvic pathology, real problems such as ovarian cysts or endometriosis. And this can, again, cause confusion. However, when Rome criteria for IBS or an IBS pattern of symptoms is also present, especially when the endometriosis is attached to the bowel wall, which sometimes occurs, from a GI IBS point of view, a trial of IBS medications may or may not improve the picture, and laparoscopy is frequently performed to get more information. But if IBS meds eliminate by more than 50 or 75% the symptoms that the individual is experiencing, despite the presence of pelvic findings, such as maybe an ovarian cyst on a sonogram or endometriosis laparoscopically, it may not be necessary to pursue laparoscopy.